Good afternoon and welcome to the Midday News. Here's what we have in the bulletin. Western Children's Hospital to be completed by mid-2024. Hotelier warns Jamaicans not to drop COVID-19 precautions. And later in sports, Jamaican referee selected for second FIFA World Cup. Thank you for joining us. I'm Shane Masters and here are the details. We begin with news that the opposition spokesman on health, Dr. Maurice Guy, is calling on the Western Regional Health Authority to address the shortage of doctors affecting the Cornwall Regional Hospital. According to Dr. Guy, between the 1st and the end of January, the hospital will be in limbo in terms of the number of doctors who are able to provide services for the people. This, he says, is a major challenge resulting from the disconnect between the Western Regional Health Authority and the Cornwall Regional Hospital.
Our patients, the poor people who cannot afford private care in this country, who in the main use Cornwall Regional Hospital, are the ones who are going to suffer. We can't have bureaucratic bungling causing that to happen in this country.
And Dr. Guy says with a rise in the number of COVID-19 cases, this is an issue of significant importance and needs to be addressed with urgency.
When you think too that Montego Bay is the tourism capital of Jamaica, Montego Bay is the area that sees most of those visitors coming to the country. We have a rise in the number of COVID cases internationally, and this will be the first call that Cornwall Regional Hospital runs the potential of not having the adequate amount of doctors to deal with the patient care.
Guy was speaking on Smile Jamaica this morning. One hotelier is cautioning Jamaicans not to drop their guard as COVID-19 cases continue to increase globally. Now, his comments come a day after China reopened its borders. Shamala Pullen has more. And we'll get back to that story. Now, Health Minister Dr. Christopher Tufton has again lamented the issue of a lack of skilled workers on the local labour force.
We have had some issues as it relates to labour and the availability of skilled labour, but I think the team have been accommodating in terms of sourcing and working with local labour, but where necessary, we have to bring labour in. You know, sometimes the debate about whether or not we should allow for importation of labor, and sometimes people are concerned, and people understandably so, and fear that we're replacing foreigners with locals. The truth is, we're already an open society. It already happens. It is a necessity if we want to make progress.
And back to an earlier story. Now, one hotelier is cautioning Jamaicans not to drop their guard again as COVID-19 cases continue to increase globally. Now, his comments come a day after China reopened its borders. Shamala Pullen has that story.
After 3 years under zero COVID restrictions, Beijing's borders are open again. And just like 2019, there has been a surge in COVID-19 cases in China. Many countries around the world have reacted by imposing a negative test requirement on travelers from Beijing. Jamaicans are again being encouraged not to let their guard down, particularly in the hotel industry. Hotelier Richard Wallace says the situation in China should not be taken lightly. He says the situation requires close monitoring here in Jamaica.
We need to watch what's going on. You realize that some countries have started restricting Chinese nationals from people visiting from China into their countries. That is something that we could look at as well. And also we need to monitor the situation. We need to be alert so that the first indication that things are getting out of hand, then we deal with it. You know, we put in the protocols that we need to mitigate the situation.
However, he said he's not worried. Mr. Wallace expressed confidence that should the variant in China reaches our shores, the country is able to tackle the problem.
I believe, you know, the fact that we've been down this road before, this time around should be easier. Now we have the experience of dealing with the pandemic, so, you know, it shouldn't be as difficult as it was before. We have been, you know, practicing safety measures, and so, as a matter of fact, some of us did not stop. We are still, you know, sanitizing, and some people are still wearing masks and so forth.
Shabella Pullen, TVJ News.
After months of frustration, the nation's teachers will go back to the bargaining table on Tuesday. Teachers have been at odds with the Finance Ministry over the salary and benefits package being offered under the new compensation review. Now, under the proposal, a teacher's aide, which is at the lowest level of the spectrum, could be earning $1.3 million for the year. Now, that's a little over $100,000 before tax. University graduates will take home just over $196,000 pre-tax. Educators who have mastered teaching several subjects will make about $245,000 before taxes. Other senior staff members, principals, would receive more. But according to the teachers, it's woefully inadequate. President of the Jamaica Teachers Association, Lasonia Harrison, is hopeful that things will be ironed out.
We return to the table to hear the full response of the Ministry of Finance and Public Service to clarifications made by us in our last meeting. The JTA will continue to be diligent and surgical in this process to ensure all nuances regarding this transition are ironed out, reducing most, if not all, anomalies.
So far, some 17 unions have signed on to the government's compensation review program. Western Jamaica could have its own children's hospital as early as next year. This as work on the $43 million Western Children and Adolescent Hospital is set to be completed by the middle of 2024. Now, the health minister provided the update following a tour of the facility. Details in this report. Work is progressing at the Western Children and Adolescent Hospital in St. James. Construction was halted at the onset of the COVID-19 pandemic. But speaking following a tour of the hospital at the weekend, Health Minister Dr. Christopher Tufton was seemingly beaming with pride.
Significant progress made over the last 2 months. We have a third floor going up to a fourth, and the front section of the building, as you can see, is all framed up. And based on the team that is here, they are expecting by the end of March to go 3 floors to the front in keeping with the design, another floor on top, and a third building where the foundation will be in place, hopefully, to put the first floor also in place.
The facility will be the first in the English-speaking Caribbean and is expected to relieve the pressure on the Bustamante Hospital for Children, located in St. Andrew.
This is going to be a specialist institution for up to 18 years old. So Bustamante Hospital for Children will be supported because you have additional beds. So people here don't have to go there for certain things, as they are now. And the specialty around 12 to 18 years old, where certain unique characteristics may be necessary to treat with that young adolescent group, will now be lodged here for the first time in the history of the country.
The health minister reiterated that 2023 will be a significant year for the country's health sector, especially along the western belt of the island.
We're hoping to continue to guide this process, working with the teams, respective teams, to see significant improvement in terms of the build-out, to see some occupation or reoccupation of parts of the entity, and hopefully at the end of it to improve patient care and to build back the confidence that we need to build back in the structural integrity of the institution. That is the key that we have to work on. So I want to reassure the people of Jamaica and Western Jamaica in particular that the work is taking place. And I personally, as minister, am very confident in the process and that the process is working.
Now, upon completion of the work with the Western Children's Hospital,
you will see the highest concentration of hospital beds anywhere in the Caribbean. You'll see more specialty, operating theaters, bed space, administrative support, and all the other critical things that are necessary to make for a modern hospital structure. Not to mention the fact that we will greatly support the other institutions that provide pediatric and adolescent care.
Ground was broken for the Western Children and Adolescents Hospital on October 23, 2019. And it's time for a break here on the Midday News, but please stay with us. More stories when we return. Welcome back to the Midday News. The St. Catherine South Police are ramping up efforts to reduce break-ins and sexual offences in the parish, following a significant rise in cases in 2022. Speaking at a recent virtual town hall meeting in the parish, head of the Area 5 Police Division, Gary Griffiths, stressed that while murders declined in the parish last year, sexual offences and break-ins posed a challenge for the security forces. For instance, while sexual offences increased by 6%, break-ins increased by a shocking 122% in 2022.
A number of things that can be done a little different going into the rest of this year. One, this neighborly approach, persons leaving their homes and their neighbors are unaware that they won't be in. I know there are instances where you can't tell your neighbors because your neighbor is not trustworthy either. But there are many instances in which neighbors can be told what is happening.
As for sexual offences, ACP Griffith says the police will have to think of alternative crime-fighting strategies.
Those would be a combination of activities. So our community safety and security branch would be held to task to educate. There are persons who are unaware of the circumstances under which a number of persons have been sexually assaulted. So they make the same mistake. However, if we can educate the public as to what not to do and circumstances that may lead to sexual offences being committed, then we can reduce the number.
A family is seeking your assistance in locating a missing relative this afternoon. She's been identified as 68-year-old Winifred Coley from Waterloo Lane in Spanish Town, St. Catherine. According to the family, Miss Coley was last seen at home on January 7. She was wearing a burgundy dress and black slippers. Anyone who sees or knows her whereabouts is being asked to call her son, Owen Coley, at 876-316-3813, the Spanish Town Police or the nearest police station. And it's now time for the Business Minute. Here's Cody and Barrett.
FESCO successfully raised $700 million from a recent bond offer to fund its ambition to enter the liquefied petroleum gasoline (LPG) market. FESCO is on a long-term growth path, primarily focused on building out its LPG division for entry into the consumer cooking gas market. FESCO said it wants to expand product and service offerings so customers can experience convenience and value for money, an initiative which requires significant capital outlay. News in oil: fuel prices increased more than 3% after China's move to reopen its borders boosted the outlook for the fuel demand and overshadowed global recession concerns. The rally was part of a wider boost for risk sentiment, supported by both the reopening of the world's biggest crude importer and hopes for less aggressive increases to U.S. interest rates. Brent crude was up $2.38 at $80.95 a barrel, while U.S. West Texas Intermediate crude rose $2.36 to $76.13. That's it for the Business Minute. I'm Cody Ann Barrett.
Now for the top regional and international stories.
In the region, the Antigua and Barbuda government says it has decided to eliminate the requirement for work permits for nationals of CARICOM who are gainfully employed in the country. This took effect on January 1. Officials say this decision follows an earlier one to waive all unpaid work permit fees, which were due on December 31 of last year. On the international scene, in the United States, more than 7,000 nurses from 2 New York City hospitals are set to strike on Monday after a failed negotiation. This comes as nurses refused to accept the same 19.1% increased wage offer agreed to by 8 other hospitals. The nurses are seeking higher pay and better working conditions. And those were the top regional and international stories. I'm Cody Ann Barrett.
And we head to a quick break. When we come back, Jordan Ford will have your midday sports report.